Good evening, all of you. Ms. Elisa Mupen, Managing Director and Group CEO. She has, in a graphic manner, in emotive fashion, imparted details about such a great activity that is being done for humanity at large. Quality healthcare, accessible healthcare, affordable healthcare has been mission of Prime Minister Narendra Modi. And over last decade, he has brought about a big change in this direction. I'll come to that a little later. But this is indeed a qualitative addition to that vision of the Prime Minister of Bharat, home to 1/6 of humanity. Mr. Hon'ble Mupen, Director. Mr. T.J. Wilson, Executive Director and Group Head, Corporate Governance. Mr. P.A. Jalil, General Manager, Corporate Social Responsibility. Primarily, it's Gupta ji, his baby. Mr. Ramesh Kumar, Chief Executive Officer, COO for Bharat. I must recognize presence of Sri Sunil Kumar Gupta, an alumnus of IIT Kanpur, one of the very senior bureaucrats of this country, 1987 batch, Indian Administrative Service. Everyone present here, doctors, nursing and logistics staff, and distinguished guests. It has been reflected in our civilization, Pehla Sukh Nirogi Kaya. As rightly hinted by Elisa Mupen, if you are not healthy, howsoever talented you may be, howsoever passionate you may be, whatever will be your capacity to contribute for human welfare, you are handicapped. And therefore, health fitness is fundamental to being a good human being. इसीलिए पहला सुख निरोगी काया. If we look at our civilizational ethos, Atharved is encyclopedic when it comes to health. And it gets a cutting edge when there is emphasis on precautionary measures, on prevention measures, on early detection, and then making it affordable. This venture, the details of which I have gathered, is a success story. A success story because this mobile clinic is so technologically empowered. And the carriage machine by Ashok Leland is customized. It makes use of the latest technology. Diagnostic tests, medical tests are available. And then you have the benefit to connect with a medical professional. And all this at the door of people who are in the last line. Prime Minister Narendra Modi has committed himself and then delivered successfully last mile delivery when it comes to health. His Ayushman Bharat program, one of the world's largest program, gives a reprieve to the people from fiscal burden by making available to them up to 5 lakh rupees health care. He has taken care recently of senior citizens. anyone who is a senior citizen, irrespective of fiscal power, will get this treatment free. When he started Swachh Bharat Abhiyan, toilet in every house, potable water in every tap in every house in villages, his primary focus was good health. Because absence of these contributed to breeding of diseases. Out of experience, having always kept his ears to the ground, the Prime Minister was aware that financial cost of treatment is spine-breaking for ordinary people. And that is why for last 10 years there has been evolution of a health mechanism in the country where affordable, accessible, quality health care is within the reach of the common man. But this experiment, a successful one, goes a step ahead. And this will have geometric results for three aspects in particular. One, it can reach out to those, even on rural roads, who cannot think of having it at their doorstep. They will not have to negotiate distance to a medical health facility available. Second, quality facility available. Government of India has also initiated telemedicine. It has been remarkable success. But this one, as I gathered, has another qualitative cutting edge. Diagnostic tests, medical tests are available through internet usage. The vehicle is so powered, so are the villages in our country. Our digital penetration that matters in such like situations has been globally applauded. For one reason, a country of 1.4 billion has accessibility to that extent that every village is so well equipped on this front. And then to be assured that there is a mobile clinic within your reach is a great assurance to the people in distress. An ambulance is different. It is much, much more than that. Therefore, it has been a very soothing aspect of corporate social responsibility. It reflects even our civilizational ethos. We must always work hard to give back to the society. It is our bounden duty, I would say divine ordainment, that we must try to help out people in distress. The country witnessed this through our health warriors during COVID. The world was stunned that a nation as diversified, geographically as challenged as Bharat could successfully meet COVID menace. And look at the vaccination, look at the technology. More than 200 million certificates were digitally given. Therefore, the technological penetration will come very handy to such kind of situations. And from that perspective, I am very optimistic that this is a futuristic step. This is a step that can be a game changer in educating people about good health, educating people about precautions they need to take, educating people about prevention aspects. And that being so, I will call upon the corporate world as such that corporate entities must converge on one platform so that the entire landscape of the country can be dotted and there is no duplication. Initiative in that direction must be taken. And I have no doubt the commitment which has been reflected by Aster volunteers and the involvement that has taken place is remarkable. The figures that have been given by Ms. Mupen are very encouraging. These two well-equipped mobile medical clinics happen to be 49th and 50th. I would expect, and I'm sure, it is implementable and achievable. It is never good to be in double digit for too long if you have anything to do with cricket. Getting into 3 digit is remarkable, soothing, exhilarating, and I am sure Aster volunteers will work in overdrive to get into 3 digits. It requires missionary zeal. It requires passion. It requires an urge to do something for the society. And I find from her address and the activities I have seen around, including the launch of one such vehicle by Governor State of Kerala, Ari Mohammad Khan, I saw the response, the enthusiasm, the spirit, and that spirit, I am sure, will take us to 3 digits sooner than we think. India is an economy at the moment in upsurge. It has exponential infrastructure, phenomenal growth, deep digitization that is being globally acclaimed. Our platforms are finding global recognition. And the nation is no longer a nation with potential. It's a nation on the rise. Having Bharat as a developed nation is no longer a dream. It's a destination to be attained at centennial celebrations in 2047. And for that, it is fundamental that we have fit India. And to have fit India, you need to have such kind of facilities so that detection is earliest, treatment is earliest, quality treatment is earliest, affordable treatment is at your door. When this happens, our target will be achieved, undoubtedly. If I give you some example by way of figures, the long journey this country has had and the quantum jump it has taken in last 10 years. Ayushman Bharat Yojana covers up to rupees 5 lakhs in hospitalization costs and has benefited already around 74 million individuals. Look at the extent of financial relief to these families. I am also satisfied and extremely pleased to let you all know that a doctor and population ratio is 1 to 836. And for a large country like ours, 1.4 billion people, this is remarkable. But this has been done in a very designed manner. Medical colleges, the number has gone up. The seats have been doubled. The paramedical services have got a great fillip on account of Ayushman Bharat. Diagnostic clinics have come up in even remote corners. And therefore, the nation would enjoy good health. Aster volunteers can take pride that in this great humanitarian activity, they are also partners. Look at the quality of healthcare mechanism that has come up in this country. There was a time when we used to have only one AIMS. It is now there in every state. Looking to the size of this country, there has been announcement of 75,000 medical seats. That being the situation, India is pharmacy of the world. I had the occasion to reflect on your pharmacy and one of your discourses that indicated its expansion extent and deep penetration. But because of such mobile clinics, there will be some kind of education to our youngsters in the villages to get skill about paramedical courses. And I just wonder the impact that it will have if a small video is shown in a rural area as to how children, young boys and girls can be skilled in services with respect to health and health care. India has had healthcare development that is now rivaling the world benchmark. Medical tourism, I was reflecting on the figures, has increased. Such like, I would say, innovative measures would inspire and motivate people to become self-employed. They'll be able to contribute to the economy, and that economy which requires a fillip at the village level. So I am extremely hopeful that this kind of public-private partnership and interconnected corporate partnership, the day is not far when every taluka, in a district we have about 6-7, will have such mobile clinics. Well, I congratulate everyone associated with this, particularly the human resource that will be manning these mobile clinics. I am sure they are trained to have empathy. They are trained to be very considerate. They are trained to be very patient. They will have an element of service ingrained in their functioning, and that will make great success of it. I wish the Aster Volunteers team all the very best for this and future endeavors. I look forward when you enter 3 digits. Thank you so much.